Good morning, everyone. My name is James L. Patterson, and I'm the president of the Partnership of African American Churches. And I'm also the pastor of Institute Church of the Nazarene. That's my day job, my full-time job. And I want to thank you for coming. And we're here today to talk about health care, particularly health disparities. And what sparked this particular news conference today is this report that was just issued by an organization called Healthcare Now for All Americans. And this group is comprised of around 1,000 organizations that reside in 45 states, 46 states nationwide. And of particular importance is the work that they did around disparities in the state of West Virginia. For an example, people of color in West Virginia live from 6 to 10 years shorter time period than do the majority population. The infant mortality rate, which is an indicator worldwide of the wellness of a particular population, is some 60% higher than in communities of color than it is in the majority community in the state of West Virginia. So this is taking place this morning because of this national healthcare debate that we find ourselves in. And we all know that we have many, many stakeholders involved in this discussion. We have the big insurance companies that our own Senator Rockefeller has been talking about, so I will let you get some of his comments that he's made over the past few days. But these people have millions of dollars at stake in terms of profits from health insurance. We have healthcare providers who have been called upon to provide health and care in many instances without receiving substantial compensation for their services. And we have the community people that I represent here this morning who have lives at stake, because if there isn't ample health care for everyone, then people will die as a result of not having that health care at their disposal. So while this national debate is taking place, those communities of color in West Virginia wants to send a message not only to our representatives in Congress and in the Senate that we want them to get behind and pass this legislation, but we will also want to let the local community know that we have to be involved and we have to be mobilized and show our concern so that whatever law is passed will address the kind of disparities that are described and defined in this report that I'm talking about this morning. That whatever regulations come out of the legislation, we here in the state of West Virginia need to make sure that they address these concerns and these disparities. Another thing that's been mentioned that a lot of the people who are standing with me this morning have been fighting for years is that this report says that there is no system of collecting scientifically significant data on the health status of minorities in the state of West Virginia, which is true. And we've been trying to make this happen for a number of years now. So in a lot of instances, we don't know what the conditions are because the data hasn't been collected. And so what we've asked the DHHR to do is to oversample those areas where we have a significant population of minorities. And in the state of West Virginia, that's primarily 13 counties where we have about 85% of the African American population. If you would oversample just Kanawha County, Cabell County, and Raleigh County, you would get the data on about 45% of the African American population. So we are saying that these are some of the things that need to happen so that we can address these health disparities and eliminate them for our minority populations in the state. So there have been some positive things that have occurred this past legislative session. There was one bill that was passed that was designed to address the social determinants of health. So Reverend Matthew Watts, who is here this morning, is going to come and talk to us about that. And the reason we are talking about that, because this is an example where the entire community, the legislature, and a lot of interested parties from the public and private sector came together to make this happen. And all the people that you see standing around this morning were a part of that. And after Pastor Watts comes and talks, then we have another young man Reverend Ron English, who is with the REACH program, who's going to come and talk to us a little bit more about disparities, as well about some of the efforts that are taking place around the state. Reverend.
Good morning, and I certainly commend Pastor Patterson and Partnership of African Churches for taking the lead in bringing this issue to our attention. The bill that Pastor Patterson referenced was House Bill 2950, the Neighborhood Housing and Economic Development Stabilization Bill that was passed into law to target some resources to communities with high minority populations to use housing as an economic development driver, housing, construction, and rehabilitation. And we think that's very important because normally the well-being of a community is directly linked to the economic activity, economic development activity. So a vibrant economic environment normally will attract resources, and for that environment to be sustained, it also requires a healthy and well workforce. And so we believe that this initiative is a humble beginning, but a beginning nevertheless, to take about $2.4 million that were remaining from the Economic Development Fund back in 2002 and have it to be reallocated to be used to serve as a catalyst or impetus to create economic development activity in these minority census tracts where the funds will eventually be awarded. This is very, very important because when there is an economic recession in this country, it means that there is an economic depression in the African American community. When America gets an economic cold, the minority community develops economic pneumonia. And this is a historical reality. Long before the economic downturn that we're currently experiencing nationally and also statewide, the unemployment rate, according to the retired Dr. Eddie Merrifield, the former director of the Bureau of Employment Programs Statistical Analysis Division, that the unemployment rate for minorities in West Virginia is at least 2 times the reported unemployment rate at any given time. And so as our employment rate moves toward 10%, that means the unemployment rate in the minority community is at least 20%, according to the experts. And Dr. Murphy also pointed out the unemployment rate for youth is at least 50%, if not higher. And those of you who regularly read the newspaper, you know that a couple of weeks ago, the Charleston Gazette ran an article about this national problem of unemployment among young people. The national unemployment rate is probably 38%, if not higher, among youth. And so, as Pastor Patterson has alluded, the economic development investment in these minority communities can also help to stimulate other activity. But it also requires simultaneously an investment in the health and the wellness of the people. If you don't have a healthy workforce, it's difficult to attract economic development because they're not going to be efficient and effective at work. So these two things they're nexus together, economic development as well as physical health and wellness. And so we're encouraged by the efforts on behalf of Delegate Carrie Webster and her legislative colleagues who were able to get the House Bill 2950 passed, and also appreciate the efforts of the governor of signing it into law. But there's millions of dollars coming into West Virginia, and so we're hopeful that this will be the start of more economic investment and impetus in these minority communities that can help lend the type of assistance necessary and also to help address the issues regarding health disparities. Thank you.